Trinidad and Tobago will continue to monitor the new variant of concern and add more countries to the list of travel restrictions if the need arises. The statement comes from Health Minister Terrence Deyalsingh after this country imposed travel restrictions on 8 countries on Friday evening. Sunil Lalla reports.
Not been detected in Trinidad and Tobago, but like all the other variants, I think it's not a matter of if it gets here, it's a matter of when it will get here.
A warning from Professor Christine Carrington that this country should brace for the entry of the new variant known as Omicron, which she says could be even more transmissible than the Delta variant. She says evidence is still being gathered about the 5th variant of concern, but stops short of saying it is more deadly.
There's no evidence for this at this point to suggest that it's more lethal, and there's no reason to automatically assume that it is. It might very well be cause less severe disease. We just don't know at this point in time.
In a media release on Friday night, the Ministry of Health took the decision to impose travel restrictions on 8 countries which have seen cases of the new variant. It added that only nationals of Trinidad and Tobago coming from these countries will be allowed entry, but would have to go into state-supervised quarantine if their stay in the countries was within 14 days. Health Minister Terrence Deyalsingh notes that a list of countries could be expanded as more information of the spread of the new variant emerges.
If and when we have to make adjustments to the travel advisories, we will do so in the interest of protecting Trinidad and Tobago from that entry into the country for as long as humanly possible.
Professor Carrington says this country does have the capacity to do testing for the Omicron variant, which could be fast-tracked.
Normally, our turnaround time for routine sort of sequencing is about a week to 2 weeks, but in a case where we have a particular concern about that it came from one of those countries where Omicron is present, we would try and turn that around more quickly.
Despite the new variant, Professor Carrington believes the vaccine would still be effective against it and urged the population to take all measures necessary to reduce their risk of getting infected. Sunil Lalla, TTT News.
This country will wait on word from the WHO regarding booster shots for the wider population. But according to Chief Medical Officer Dr. Roshan Parasram, there is a possibility that this will be approved in December. He says the WHO will meet in the first week in December to have a definitive position of boosters. If and when this is approved, Dr. Parasram says this country will begin to roll out booster shots for the general public.
The guidelines suggest that you use boosters 6 months and more after your second dose. So in Trinidad and Tobago, that will mean that people begin receiving boosters if and when it is approved after December or late December into early January for the first batch of people that receive their vaccines in April. So having said that, we look out for WHO's approval or go ahead sometime in December. And if and when they do approve, of course, Trinidad and Tobago, aligned to the WHO policies, will as well go forward with our booster doses.